Hi, my name is Robin. I'm a dental hygienist and a myofunctional therapist, and I talk about all things oral health. Today I'm talking about taking care of children's teeth. And as a dental hygienist, that is a big part of my job and always has been, is taking care of people's teeth and teaching children and parents how to take care of teeth as well. I will just be giving you some simple, effective tips and things to think about to get you started. So when children come to the dentist, when they get their very first little baby teeth, we want them to be brushing their teeth. First thing, first sign of teeth. You want to get in there and help teach that kid that we are going to be using a toothbrush and we're going to be going in your mouth and just help normalize that for them. So as soon as they get teeth, they can get cavities. So we want to make sure we start that process really early to help just develop that habit for the child. You can gently wipe the teeth with a washcloth or a rag even before they get teeth to again help build that habit of going in their mouth and doing that little hygiene step there. They should be brushing their teeth twice a day, morning and night, especially before bedtime. Anything that's on the teeth all day just sits on there all night, so you want to make sure you do not go to bed with dirty teeth. Applies for everyone, not just kids, but definitely for little kids. Their enamel is much thinner than adult teeth, so these cavities on these little kids can get really big really fast. So you want to make sure to start early and really make sure we get those good hygiene habits in as soon as they have teeth. Some parents in the office will tell us that their kid doesn't like it or their kid fights it, and we just try to tell them like this is just a non-negotiable thing. You have to make it happen every day. And when your child sees that putting up a bit of a fight doesn't get them anywhere, they have to do the brushing anyway, then eventually they do relent and they understand that this is part of their daily routine. I have a friend who tells her children when they were little and they wanted to fight about it, she would say, we can do this the easy way or we can do this the hard way. And she would just lay them down and get the teeth brushed. A trick that she uses to get in there when they're trying to close and clench and not let her in is she would lay the child back in her lap and then she would use the end of a toothbrush to prop between the teeth, and then she could get in there and do her brushing and flossing with another toothbrush and with a little floss picks, and that helps kind of keep their little teeth open so mom doesn't get bit or dad doesn't get bit, and the child gets a thorough brushing done every single night. So just a couple things to keep in mind for kids who try to fight oral hygiene every day. Definitely a non-negotiable. It's worth the battle because kids with little cavities in their teeth when they're real little, it's tough to get them fixed and it's kind of scarring to them. So if we can prevent it, that's key. It's definitely worth the battle. So when you're doing your brushing, you want to make sure you're using a soft bristled toothbrush, a tiny smear of a fluoride or hydroxyapatite toothpaste when they're under 3, or a pea-sized amount when they are over 3 is ideal. Parents really need to supervise brushing until they're 7 or 8 years old. The kids will try to be independent and want to do it themselves, which is fine, but then mom and dad need to take a turn as well after to make sure that the job is done thoroughly, and that needs to happen until they're at least 7 or 8 years old. And of course, once the teeth are touching, you need to be flossing every day. Brushing alone will not prevent cavities between the teeth. Those spaces have to be flossed. You can use little floss picks. You could use the string around the finger. Again, if you're struggling to get into their little tiny mouth because they're not giving you enough room or space, use the end of the toothbrush and just kind of use it as a gentle prop between the back teeth, and that will help you get in there and get that flossing done for your child. Watching the sugar, watching the snacking is key as well. We all know sugar causes cavities, but you have to keep in mind that it's not just candy or pop. It's any beverage besides pH neutral water that can cause cavities, including milk, especially juice. Some people believe juice to be healthy because it's a fruit juice, but it's full of sugar and it's really hard on teeth. Also crackers, like those little golden fish shaped crackers. Those kind of snacks seem healthier than like a candy or something, but those cause a lot of cavities. So just that constant snacking and the constant exposure for your teeth to these carbohydrates is really a huge cause of cavity. So keep in mind that constant snacking is causing a lot of problems we're seeing every single day in the dental office. So minimizing that and trying to drink water as much as possible. Have your milk with meals, but try to stick to water between and try to eliminate snacking or reduce it as best you can. Also, sticky things like gummy items are really hard on teeth. A lot of parents are using gummy vitamins because they taste better than the chalky versions of vitamins, but we are seeing that be a huge cause of cavities as well. Parents come in and they have a relatively clean diet, they're doing really well with their hygiene, and these poor kids have a ton of cavities and they just don't understand how that happened. And a lot of times we find that the only thing that really is the problem is the gummy vitamin or gummy melatonin. Those gummy sticky things really just hold that sugar in there, and they can cause a lot of problems. We also don't want to underestimate the importance of monitoring for that mouth breathing. Mouth breathing, especially at night, is really hard on teeth. It dries out the mouth, which eliminates the saliva, which tries to help to rinse away and neutralize the acids in your teeth. So if you're mouth breathing, your risk of cavity is way huge. So you just need to really monitor that. If you see your child is mouth breathing, find a provider who can look into it and give you a full evaluation to see if there's something you can do to make that better. Myofunctional therapy helps. You always have to get to the root cause of the mouth breathing, whether it's allergies, congestion, whether it's adenoid tonsils, or whether it's just weak, low tongue posture, which can all be corrected with the proper referral or the proper treatment. And so definitely keep an eye on your child at night, peek in on them, make sure they aren't mouth breathing. And if they are, definitely get that checked. Of course, another big piece of the puzzle is routine dental care. You want to get your child's teeth checked every 6 months and get their teeth cleaned, get proper x-rays as indicated to make sure there are no problems underneath. We can spot cavities very early with an x-ray, where if you wait until you can see it clinically in the mouth, it is way bigger and sometimes requires more extensive treatment. So get the proper x-rays, get your teeth cleaned, get them checked by a professional, cleaned by a dental professional as well, so that any issues that we see or potential causes for future issues can be caught as early as possible. Of course, protecting teeth during sports, using an athletic guard when indicated for different contact sports is always ideal as well for caring for teeth, just to prevent any sort of trauma or injury. And of course, leading by example is always key as well. When children see you making healthy food and snacking choices and not just drinking pop all day or anything like that, they will follow suit. When they see that you are brushing morning and night and flossing every day, they as well will see that that is normal, and they will follow suit as well. So leading by example, always important. If you have any other questions or want to hear about another topic, please let me know in the comments.